Hi, I'm Ron Verostic of Verostic Tax and Financial. Today we're going to do an educational only presentation on Medicare. It's educational only because under Medicare rules there are certain things you can do and cannot do. Under the educational only, we cannot mention specific company names, specific company plans, or specific company prices, at least as far as the Medicare Advantage programs are concerned. On Medicare Supplement, it's a little looser as far as the regulations are concerned, and we will mention a plan or two and a couple of prices there. But I also say this because we want you to ask questions, we want you to leave comments underneath afterwards, and please do that. But know that if you ask for specific information, I can't give it to you publicly, such as which company were you talking about. I can't tell you that. But I can, of course, in a private phone conversation or a one-on-one meeting. So just be careful on the comments. Also, I don't want you asking a question where you're giving out personal information that maybe you shouldn't be giving out, such as health conditions and all of that. So feel free to ask general type questions underneath and leave comments, but just know that there's certain answers I can't give in general. So, like I said, this information is for people who are turning 65, leaving their current employer even after they're age 65, or anybody who's past the age of 65 and reconsidering if they chose correctly for themselves as far as which Medicare program to go with. So that's what we're going to cover today. Medicare started in 1965, and first you have Part A, and Part A takes care of your hospitals and skilled nursing and different avenues like that, whereas Part B covers your hospitals, your doctors and your lab work. So we're going to cover each of them a little bit. A comes automatically, you don't pay anything extra for it, but of course B does. And so that's where we're going to start, is with what how Medicare Part B works and what the costs are. So for 2021, the Part B premium, they haven't actually told us the number yet, but they're projecting it to be $148.50 a month. So if you're on Social Security, that automatically comes out of your Social Security check. If you are not taking your Social Security benefit yet, then they bill you for that on a quarterly basis. So whatever 3 times $148.50 is, that's what your bill will be every 3 months, and you have to send in that check. So that's the Medicare's Part A and B. Part A covers hospitalization, skilled nursing care, and a couple other things such as that. Part B is basically all of your doctor bills, your lab work, few certain medications and that. So that's your A and B, and like I said, they decide on the prices and then they pay 80%. Hence, that means there's a bill left over. Now, before we decide how much of the bill that's left over, there's one more thing you have to understand, and that's called Medicare Assignment. So if a doctor says, okay, my bill's $100, Medicare says, for those visits we're only paying $80, or $80 is the appropriate price, then if the doctor accepts $80 as full payment instead of $100, then that's called Medicare Assignment. So he agrees that once he's got the amount that Medicare says is the correct amount, he will consider himself paid in full. Now, if they take Medicare but they do not accept assignment, then that means that Medicare tells them, if you're going to deal with us at all, you cannot charge more than 15% of what we approved as the correct amount. So back in this case, he says 100, Medicare says 80, and so if he does not accept assignment, he could charge 15% more than the 80. So that works out to be $12 more, so that'd be like $92. So he still doesn't get his 100, but he could collect as much as 92. Now, you got to remember, Medicare only paid 80% of the 80, so you owe everything from $64 on up. Now, if you have a Medicare supplement, that takes care of that for you. Some of the supplements take care of everything up to the $80, and some of them will cover even the excess if the doctor does not accept assignment. So in this case, I can tell you a little bit about those plans. A Plan G is the most comprehensive of the plans because it will cover all of it. It would cover all the way up to the $92 if that's what was necessary. a Plan G, why we like the Plan G is they have a very small deductible. There used to be a Plan F up until this year, which covered everything. But a Plan G covers almost everything. It covers everything except for a $200 deductible. Last year it was $195. They're projecting for 2021 that it's going to be $200. So a Plan G will cover everything up into that point. Now, on top of your medical bills, the other thing you have is prescription drugs. And so you have to have that covered also. And why I say you have to have that covered is because if you don't have it covered, the government gets to hit you with a penalty, and I'm going to explain that here in just a second. And that penalty lasts for a lifetime, so you definitely want to have it. So it's called Medicare Plan D, covers your drugs. And there's lots of variations of it, and I have to say the government's done a really good job of putting together a great website that helps you decide which Plan D is going to work for best for you, or you can get an agent to help you. But if you use the Medicare.gov website, it's going to help you a lot, because you can put in all of your drugs, you put in, the quantity, and you put in the dosage, and it takes all that into consideration. It asks which pharmacy you like to use, and they will put it all in there, and they'll tell you what your price is going to be per month for the coming year, and they'll even tell you drug by drug what your price is going to be. So it's really a great tool to use. Anyway, those plans will run anywhere between about $15 and $70 a month. Most of them tend to go on the lower end, but some people who need more expensive drugs, they're better off with a more expensive plan. But it will show you all the plans, and there's usually 8, 10, 12 plans that are available for every given zip code, and so it's good to take a look at that. Anyway, if you do not sign up for a Plan D, then the penalty goes like this. They get to charge you 1% more per month in penalty at the time when you finally started. So let's say at 65 you decide, I'm healthy, I don't take any drugs, I don't want to have a prescription drug plan, I'll just go ahead and pay the penalty. Well, you're fine and dandy until age 70. All of a sudden, age 70, a few things start happening, all of a sudden now you need some drugs, or you start having to get prescribed drugs, and so now you want the Plan D. So what the government says, well, that's been 5 years that you should have been under a Plan D and you weren't. At 1% per month, that's 60% of a penalty that you're going to get, and you're going to pay that for the rest of your life. And they're not going to charge you 60% more of the plan that you actually want or take, because you might be able to get one of the cheap plans. They're going to charge you 60% of whatever the average Plan D price is. So for right now, the average Plan D price is about $34. So that's taking the lowest and the highest, and coming in to an average of about $34. So even though you might only need a $15 or an $18 program, you're going to pay the penalty of 60% of $34, and you will pay that for the rest of your life. So it pays to just, if you're not taking any drugs or just very few and a couple of generics, then just go ahead and choose the cheapest plan out there. They allow you to change which drug plan you're taking every single year. So if something else happens, you need a better drug plan the next year, you just go ahead and get a better one. So let's look at the cost of just the Medicare by itself, plus the supplement, plus the Part D, and see how this works out for people so that you know what you're looking at. So like I said, the Part B premium is going to be $148.50 per month, and you're going to pay that no matter which Medicare plan you choose to go under. You are going to pay that $148.50 a month. The Plan G, like I said, that's the most comprehensive of the plans. There's other plans, I'd be glad to show them to you and show you the differences, but the other plans start having more co-payments and deductibles and stuff like this. This is the most comprehensive, and it runs about $120 to $130 a month for somebody who's age 65. Women are a little bit less expensive than men. It does change by zip code. That's about the only thing that actually makes a change. And then the other thing you need to know is under a Plan G, the price will go up every year. As you get 1 year older, the price goes up a little bit. And of course, sometimes they go up once in a while just because of cost of living, because they start taking up the deductibles, meaning the government says the deductibles are higher and they have to cover it somehow. So the insurance companies end up charging a little bit more. But these will get a little bit more expensive every single year that you own one. Then the Part D plan, like I said, that'll run you somewhere between $15 and $70 a month. So when you take the whole thing and put it all together, you're going to end up with about $300 a month. So that's about $3,600 a year. After that, the only other costs you're going to have is your $200 once a year deductible. So whoever you go see at the beginning of the year, you pay the first $200, but then after that, everything is covered for the rest of the year. Everything is covered. So altogether, that's going to work out to be about $3,600 a year plus your $200. That's kind of the neat part, and we're going to get into pros and cons later on in this presentation, but that's one of the neat parts about the original Medicare plus a supplement is you know what your costs are going to be for the year. Your minimum and your maximum are going to be one and the same, because it's going to be whatever your premiums were plus that $200 and you're done for the year. Now you do have, plus your drugs. I have the drug policy in here, but you still have the cost of the actual drugs to come in here, and that once again will be the same no matter which plan you take. So this is your total for your Medicare plus a supplement plus Plan D. So your other choice, and this is the one that you hear about, this is the open season. So let's talk about open season just for a moment. Open season's coming up. That's between October 15th and December 7th is when you get to change plans. This is what you're hearing about on television. You get a whole lot of mail about it. On a Medicare supplement, there's no such thing as an open season, and yet it's open season all the time. So long as you can qualify, there's an open season. You can buy a supplemental plan anytime you want. You don't have to wait for that October 15th to roll around every year. Now on the Plan Ds, the open season does happen once a year. But the supplements, you can buy that anytime when you're healthy enough. And that is kind of the trick, because if you don't buy it when you're healthy enough, then you might not ever get to buy it. Then you might be stuck with Medicare Advantage plans for the rest of your life. I say stuck with it, but it's still a good plan, but that might be where you actually end up. So the second choice here is our Medicare Part C, also known as Medicare Advantage plans. Now they are quite different. What happens with a Medicare Advantage plan is Medicare is no longer actually responsible for you. They pay the insurance companies a flat amount per month, and now the insurance company is totally responsible for all of your medical bills, except for what they decide to pass on to you through co-payments. And don't feel too bad for the insurance companies here. They get paid quite a bit of money. It's really a hard number to find. I've searched for it many, many times. And the one that I can find fairly consistently is they show you how much they pay in the state of California per month for every person that they have on the insurance plan. And under those, and I'm sure it's pretty close to the same nationwide, but even in California, it varies county by county. But I know it's pretty close to the same. So it's a little bit over $900 a month that Medicare pays the insurance company, and then the insurance company is totally responsible for your medical bills. Now, like I said at the beginning, you still have to pay the Part B premium. You still pay that into Medicare, the $148.50 a month. So it's not like you get out of that part by coming over to a Medicare Advantage program. So you're still going to have that, and then Medicare on top of that, well, in place of that or whatever, they pay the insurance companies, the amount that they have agreed upon, which is somewhere around $900 a month for every single person that the insurance company has under one of their plans. So the pricing on, and we're going to get to the pros and cons, and I'll explain a little bit more about Medicare Advantage as we get down into this part here and in the pros and cons. But just for the price comparison again, so we have our Part B, which is the $148.50 per month, which is the same as over here. But now the plan premiums are down drastically. A lot of them are what they call a $0 premium. Now we can't say they're free. Medicare doesn't allow that. Nobody could say that they're free. They call it a $0 premium. Take it for what you will, but that's what they call them. And so why would some be zero, but some others might be as high as 50, and it could be anywhere between those two numbers. And a lot of it has to do with the networks. When you go with the Medicare Advantage program, you have to deal with the insurance company's network. On the Medicare supplemental plans, you get to go see any doctor anywhere, anytime, pretty much. Here you have to deal with the networks. And so if you stay pretty close to home most of the time, you could go with a fairly small network, just the network for like your county, or maybe it covers a couple counties. But then they have larger networks that will cover several counties, and then they have really large networks which will cover several states or even nationwide. So if you're a person who does a lot of traveling or spending a lot of time somewhere else, like you're a snowbird and you spend 6 months of the year down in Florida or South Texas or Arizona, something like that, well then you're going to want a plan that's going to cover you in both places, and so you need the larger network, and that's where it might make more sense to go with a little bit more comprehensive plan that has a much larger network. And so that's why there's a price difference in Medicare Advantage programs. They get paid the same from the government no matter which one you take, but you may have to pay a little bit more to get what you want. So your minimum out of pocket, if you're really healthy and you never go to the doctor, you never go to the hospital or anything for the course of the year, it's only going to be $1,700, because that's the $148.50 per month is $1,782. So if you were really healthy and had a really good year, and most of these have the drug program built into it, then you might get away with spending that little for your health care for that year, but that's only going to happen in years where you're totally healthy for the whole year, which doesn't happen for too many of us. Okay, so your other possible costs with the Medicare, of course, would be whenever you go to a specialist, you're going to have a copayment. And that's going to run you anywhere between $30 and $50 a month, depending again on which plan that you have. Outpatient, so if you have outpatient surgery, and most surgeries anymore are outpatient, if you have an outpatient surgery, that's going to run you around $170 to $300 per visit. There's also co-payments for lab work and a few other things. Your hospital copayment, this is the biggest of the bunch, and it's $225 to $300 per day for the first 5 or 6 days, and that's can't happen more than once a year. So if you go in the hospital and you're there for 5 days, you'll pay that $225 to $300 for those 5 days. 2-3 months later, you're back in the hospital for another 5 days, you get to pay that all over again. So this is where the cost can jump up on you. So our maximum out of pockets, it's a really, really big ballpark. It could be anywhere between $3,500, because the one thing that they do say is, okay, since you are making co-payments, we'll make sure that you don't go over a certain amount. And so that's why they call it maximum out of pocket. Some of the plans have a maximum out of pocket as low as $3,500. Some of them have a maximum out of pocket as high as $7,000. So these are the things you want to be looking at when you're comparing plans against each other, along with the prices, to see, you know, what's your true exposure to the risk. How much could it cost you over the course of a year? So our maximum out of pocket, the $3,500 to $7,000 here, plus, of course, we have to pay this, because like I said, this gets paid regardless. And so your total maximum out of pocket could be anywhere from $5,300 to $8,700 on a Medicare Advantage program, whereas you may remember over here we know it's basically $3,800 versus this. But this one we know is going to happen even if you have a healthy year, it's still going to happen. This one's going to happen in a bad year, may not happen. And at the very end, we're going to show you there is a way to basically eliminate this one here. So if we eliminated the hospital co-payments, that would bring our maximum out of pocket down quite a bit, and that might be a good alternative for people. Like I said, at the very end of the presentation, I'll show you a way to change this or have this covered for you with a slightly smaller policy. So we're going to break right here and change our board, and we'll come right back and we'll go into the pros and cons of the different Medicare programs. So now we're going to talk about the pros and cons. First, we're going to cover the pros here of the different Medicare programs, because we want to make sure that you get what works best for you. I know it's very frustrating out there. There's a lot of television commercials, you get a lot of stuff in the mail, and they're going to tell you what they want you to hear about their particular program. And that's one of the points of why we're doing this whole presentation is you have a choice. You could call an 800 number and get somebody to help you there, but I'll guarantee you on most of those 800 numbers you're going to get the choice of one company, one program, maybe a couple programs. Whereas if you deal with a local agent, such as myself or any of the other local agents around here, you can get the full story. You can hear about Medicare and supplemental programs. You can hear about the Medicare Advantage programs. And you can see which one is actually going to work best for you. There are pros and cons to both programs, and therefore we want you to know all of that so you can make the best decision for you. So let's cover the pros first. So here we have back to the original Medicare plus the supplemental plus the Part D. And the pros to this particular Medicare, the original Medicare, is, for one, the fixed cost per year. Like I showed you just a few minutes ago, your costs are going to stay the same. It's going to be about $300 a month for all your premiums, and then you're going to have your $200 deductible, and everything else is covered after that for the entire year. So your total cost for the year is going to be about $3,800. No more, no less. It's a fixed cost, it's easy to budget. Any doctor who accepts Medicare, you can go to any of them. If you want to go to a specialist, you go to a specialist. If you banged up your knee or your elbow and you know you need an orthopedic surgeon, you don't have to go to a primary care doctor first just so he can tell you to go to the specialist. If you need a specialist, you just go to a specialist. Ear, nose, and throat, doesn't matter. Almost all doctors accept Medicare, it's over 90%, and almost all doctors accept Medicare Assignment, which we covered in the first part. So you really don't have to worry too much about that, especially if you have a Plan G, you don't have to worry about it at all. So any doctor who accepts Medicare, you can go to that doctor, which also means anywhere in the United States. It doesn't matter. You don't have to worry about networks. You don't have to worry about referrals. You don't have to worry when you're traveling. You are covered no matter where you are, because there's doctors all over the United States, and all hospitals have to take Medicare. So you're going to be covered fine and dandy, which also means you don't have the referrals. And why I put that down in separate is because referrals also take time. And it's frustrating enough when you find out you can't go see your doctor, the doctor you want to see, for a week because they're all booked up or whatever, to add an extra 3 or 4 days on there because that's how long it takes to get a referral lots of times from one doctor to the other. Now you're going into the 10 days for 2 weeks period before you get to go see the doctor that you really wanted to go see in the first place. So those are the pros for the Medicare plus the supplement plus a Plan D program. And you can still change the Plan D every year if you need to, because Plan D actually falls kind of more in with Medicare Advantage programs, but it is a standalone program over here. Over here it's usually built into your Medicare Advantage programs. So let's talk about the Medicare Advantage programs. The pros for this are, for one, it's a very low premium. Like I showed you back on the other page, we're talking anywhere between $0 per month and $50 a month, and more than half of them are probably at the $0 a month. They're definitely on the low end. So they're very affordable so long as you're healthy. Now, like I showed you on the other page, if you end up going to the hospital a couple times during the course of the year and your co-payments run up to, $1,500–1,800, you got to pay that 2 or 3 times during the course of the year, plus all your other co-payments, then that's not going to be the case. It's not going to be a real affordable program for you. But so long as you're healthy, they're very affordable programs, and you still might prefer to go this way, even if you're not, depending on your total cost of drugs and everything else. The other nice thing about the Medicare Advantage programs, and this is the part you hear about on television all the time, is the extra benefits that they provide that you do not get under the Medicare supplement plus the supplements. So they have provisions for you to be able to go to eye doctors to get your eyes checked once a year, and they'll even help pay for part of your prescription glasses once a year, once every other year, depending on the plan. They have some hearing or hearing aid benefits where you could go get that tested and possibly get some help with the purchase of hearing aids if you should so need them. They have access to fitness programs. Silver Sneakers is the big one that a lot of the programs are connected with, which once again, that's kind of nice because if you're out traveling, there's silver, sneaker, gyms and exercise places all over the United States, and you get to just walk in and go ahead and use those. So it's a nice extra benefit. And now, and this is fairly new, you've probably heard this one, if you need transportation to a doctor's office or for lab work or whatever, they will provide that for you at either very low or very minimal cost once in a while at no cost whatsoever. So those are the pros. We're going to come back in just a minute here and do the cons on both of them, and then we'll finish up after that with the one little thing about how to get around not having to pay those huge $225 to $300 hospital copays. So be right back. So now let's look at the cons. And it's not that there's anything wrong with any of these policies, it's just there's good points and there's some not so good points, or strong points and some weaker points. So maybe pros and cons, I should have just said strong points, weak points. But here's the things that you need to know before it happens. Usually that's when something's really wrong, it's because you didn't see it coming. As long as you see it coming and you made the decision and you knew the possibility exists, then it's not going to bother you near as badly because you've already accepted that risk inside your head. So, the cons, as far as the original Medicare programs along with the supplement and Plan D would be, they are definitely more expensive if you are healthy, because we know this is going to cost us about $3,800 a year, whereas the other one might cost us as low as $1,700. These could definitely be the more expensive programs for you when you're healthy. But something else is going to come into play there here at the end. I'll get right to that. Because on these plans, they are not guaranteed acceptance. In other words, they do not have to accept you into the plan if they don't want you, except during certain times. When you first turn 65, they have to take you regardless of your health. No pre-existing conditions. They cannot underwrite you. When you first quit working, let's say you quit working at 66 or 67, and you stayed under your employer's program up until that point in time. When you quit working, then you have a guaranteed acceptance period to where they have to take you. If you move from one state to another, sometimes even from one county to another, usually it takes further than that because they don't have networks. But if you move from one state to another and the plan that you had is not a current plan in your current state, or wasn't a plan in both states, then there's a guaranteed acceptance period. Other than that, they get to underwrite you. So there are conditions that you may have, like you've been in the hospital twice within the last year. They could say, no, thank you, we don't want you, and they don't have to take you at any price. And so a lot of people, a lot of times, they want to go with the less expensive plan on a monthly basis, but then later on as they start getting older and they need more and more services, they're finding out that one's not the least expensive plan anymore, and they want to switch here, and then we have to tell them, sorry, you can't have this one because they're not going to accept you. On the other hand, like I said, it's always open season over here. You can always try and get on one of these plans if you want to, and if they get accepted, then you can stop the other one. So that's the weak points here as far as that's concerned. So now the weak points as far as Medicare Advantage programs are, for one, we do have the networks. You don't get to go to just any doctor that you want to go to. You have to go to doctors within that network, including specialists. So if you do need to go see a specialist, for one, you have to get a referral in most cases, not always. There are some plans now that are saying you don't have to get referrals to go to a specialist. A lot of them still say you need the referral. So, but the referral, you still have to stay within your network. Now, a lot of the plans will let you go out of network, but in that case, you get to pay the entire bill. So, you got to take that into consideration. How much of the bill are you going to pay? And it's not like Medicare paid any of the bill for you, because remember, Medicare is not paying any bills over here. So you're going to get the bill. You're going to at least pay the difference, if not the whole bill, if you go outside of the network. Now, in case of emergencies or something, that's different. They'll take care of that. But when you're going to a regular doctor, even a regular specialist, and it's not an emergency, they're not in the network, it's going to get quite expensive for you. Okay. Pre-approvals. What's different between these pre-approvals for some surgeries, and that the insurance company gets to choose whether or not you're going to have that surgery or where you're going to have that surgery. It may not be at the hospital of your choice, even though it might be in their network. They might want you in a different hospital. And they also get to choose whether or not you actually get to have the surgery, which this part actually, put it quite this way, kind of cracks me up, because so many people are so worried about the national health care and that they don't want the government telling their doctors and them what they can and cannot do. But so many people have no problem whatsoever letting an insurance company tell them what they can and cannot have. So it's kind of ironic at that point. But anyway, so they can, a lot of them do ask or demand pre-approvals before a lot of the surgeries. And then this one could be costly. Like I said, if you start going to the hospital a couple times, plus you have all the other co-payments, yeah, maybe on a monthly basis you came out okay, but the less healthy you are, the more expensive this plan gets, and especially if you decide to go to a doctor outside the network. Say you wanted a second opinion and you didn't want it from the same group of doctors, you're going to pay for that one. So these are the things you have to watch out for. Now, like I said, as far as the costly concerned, one of the biggest costs with the Medicare Advantage programs is that $225 to $300 per day co-payment if you're in a hospital for up to 5 or 6 days. So there is a small plan called hospital indemnity plans, and we're going to cover that next, and that'll be the last part of this presentation. So I'll be right back in just a second with that explanation for you. So we are back with the last part of this presentation, and we're going to talk about hospital indemnity plans. Like we said earlier, one of the big parts with the Medicare Advantage programs is that big daily co-payment that you have if you go in the hospital, anywhere from $225 to $300 a day for 5 or 6 days. So other companies, you cannot buy these through the same companies that you buy your Medicare Advantage program with, but there's other companies who specialize just in these little plans. And so what they do is you can buy them anywhere between $100 and $300 per day. The price varies according to what you choose, and it's your choice. And they last for 6 days, and it can happen more than once a year. Just like you could go to the hospital once a year, this will happen more than once, or can happen more than once, so long as there's 60 days between when you got out of the hospital and when you go back into the hospital. This thing could pay all over again for you. So that's the basics behind these plans. Just so you get some idea, the prices for age 65, it's going to run you about $17 a month to cover this co-payment. And if you wait till you're age 70, it's not much more, it's only $20 a month. Now what's interesting about these, because it's a standalone plan, it's not part of the Medicare Advantage programs at all, it's just built to help cover that gap in those programs, is that you can actually buy this even before you go on Medicare. So if you have a high deductible plan through your employer or something like that, you can have one of these plans to help pay part of your hospital bill if you should ever go into hospital, which could help lower, those $6,000 deductibles. So just so you know, they are available. The other nice thing about these is that they do not increase in price. Once you buy it, you stick at the price that you bought it for as long as you own the policy. So just wanted to let you know those are available. So even if you already have your Medicare Advantage program and you've had it for several years and you're happy with it and you're happy with that agent and all that, if they haven't told you about these to help cover that extra cost, well, feel free to give us a call. We can help you with that. Like I said, it's what's called a standalone plan. Other than that, if you have questions, we're going to put the phone number down here across the bottom of the screen, and give us a call. You can also leave comments or questions underneath here on YouTube. Like I said, if they're very specific, then I'm not going to be able to answer it here on YouTube, and I would contact you and say, hey, let's do this offline. Let's have a private telephone conversation. Don't leave the world any of your personal information, such as health conditions that you might have. Don't talk about that in the comments. Just the comments are for general type comments or general type questions. Other than that, please feel free to give a call and or set up an appointment. We could do do either one would be fine and dandy. And like I said, your choices are, you can call an 800 number and deal with somebody who you will never meet or talk to again, or you can have yourself a nice local agent who can help you when and if things aren't going exactly right and as planned, which, as we all know in this world, that happens at times. So thanks for taking the time to watch this entire presentation. Hopefully it's been helpful to you and it will help you make a better decision as to what works best for you. See you soon.